offer all aspects of general surgery. That's all abdominal surgeries, breast surgery for benign and malignant breast conditions, thyroid surgeries, but I have gotten sort of a specialty at varicose veins, which we do in the office. First, you need to understand what venous reflux disease is. Veins are meant to be a one-way street. Blood is supposed to come up towards your heart and not fall back down, so there's valves on the inside that cause it not to be able to fall back down. But when those valves malfunction, blood is allowed to pool by gravity in your legs, and that causes a lot of aching and heaviness and cramping, restless legs, itching, that kind of thing. In order to prevent it falling down in your legs, we have to fix the vein that's the problem. That's usually your saphenous vein that's on the inner thigh. So what we can do is put a small laser, tiny as a hair, in that vein, that's the problem, and heat it up from the inside so that it is destroyed basically, but it stays in place. It only takes a needle stick. It's like getting a couple of shots in your leg, and it works so incredibly well that 99% of people have it resolved with just that procedure. We do ask patients to come back within 48 hours to get an ultrasound to make sure everything looks like it should. Other than that, once we've done all of the procedures that a particular patient needs, we see them again in about 2 weeks and make sure they feel as good as they want to. Our goal is to make everybody feel serene and comfortable all the way through the process. And my staff is very committed to having everybody have the same good experience, and we have a lot of people say that they really felt great from the time they got to sit in the waiting room, and hopefully that's not long until their procedure is done. Well, we chose our color scheme so that it would reflect some serenity, some peace, and so all of our artwork has to do with water scenes and flowers. I really wanted it to be sort of like a spa so that people felt that they were getting a spa treatment when they came to get this procedure done. Although it's a serious medical procedure and it's for a serious medical problem, I would like people to feel that they got a spa experience.
I guess it started back when I had my daughter 13 years ago. Being a nurse on the floor, I was always up all over the place, walking on my legs. And as the years went by, the pain and the aching got worse and worse. And then I had my second child, and it continued to get worse. And between being a nurse, between being an active mom, the pain was only so much I could take. So I heard about Dr. Stewart and the procedure that she had done from other nurses at the hospital and thought I'd give it a try. So I came over and saw her, met with her, and she is wonderful. The minute you walk in the room, she makes you feel so special. And she explains everything to you, what's going to happen, the effects of afterwards. She's just phenomenal. After having the procedure, the pain within days, the pain was gone. The achingness was gone. The swelling was gone. I felt like a new person. I was fine with wearing shorts again. I was fine with wearing bathing suits again. Before, I didn't. But now, I wear shorts everywhere I go.
It was lazy legs, it was tired legs, it was veined up legs. You know how you walked in and you see people with a vein, it's just so noticeable you would look. Driving to Kentucky, I used to have to stop on a regular basis because of uncomfortable leg. And after the procedure, it became a lot better on my trips. It improved a great deal from my walking now. Problem I didn't know I had.
Most people say that they felt a difference the very next day. Most people have immediate relief of their symptoms of varicose veins, which are cramping and aching and heaviness, a lot of things that people think are normal with aging, but they're not. And they said, I can walk now. We have a little ongoing joke about the shopping test, and people tell us they can shop all day. And they used to not be able to do that. So I get a lot of talk about how much more people can do after their procedure than before, and they didn't know that they were going to feel that much better.